Welcome to Perimenopause with Dr. Lauren Ward-Sellinger, naturopathic physician and Menopause Society certified practitioner, focusing on integrative health support for perimenopause and beyond, bringing you applicable tools and information to help you on your journey. Enjoy the ride that we will share here on Perimenopause. Hello, welcome to the Perimenopause podcast. I am Lauren Ward-Sellinger. I'm a naturopathic physician in Bend, Oregon, where I practice customized functional medicine and hormone management for perimenopause, menopause, and andropause. I am a practicing physician, and I am doing this podcast mainly to help people and spread information that is evidence-based and tried and true from an actual clinician using it every day. So today's topic, what no one is telling you about testosterone. It's come to my attention that there are a lot of opinions regarding testosterone use in women specifically, but also some misconceptions in men. So I wanted to record this short video just to discuss what I think is being left out of the conversation that's really important. So let's talk about labs. The normal ranges, if you go to a lab, is about 2 to 60 for women and 300 to 1,000 for men. So some labs will have slightly different ranges, but that's what I see to be kind of the typical conventional range. For many years, I believed in this lab range, and I no longer do. It's just not a great guide for somebody who's in midlife. If we're diagnosing someone with PCOS, which is polycystic ovary syndrome, I do think that this range could be appropriate. And there's usually some other things going on, like some blood sugar dysfunction when we're talking about PCOS. So it's not exclusively about testosterone. But if we're dealing with midlife issues such as low libido, low energy, inability to climax, ADHD symptoms, depression, weight gain, lack of payoff at the gym, then I just don't find this range to be extremely helpful, and I find it to be too low. So this is very individual, but I am finding that for women, at least a level of 60, and I'm comfortable going up over 100 with women if we're treating them with testosterone, is typically going to be a better gauge for actual optimal levels. And for men, I like to see them at least 600, but I will go up much higher, all the way up to 1,000 or even 1,200, depending on the man and depending on their response to treatment. So if someone comes in and they tell me that their labs have been normal for testosterone, I want to see that number for myself and decide if we're going to go ahead and try treating them. And as with all medical interventions, you want to start treatment and then see how someone's feeling, remeasure their labs, see how things are progressing, decide if we keep going up. Are there any negative symptoms that are happening that are worth discontinuing treatment? So it's very individual, very customized. And I think that it takes a provider who does it a lot to really understand that. So for myself personally, whenever I would get my testosterone tested, I was in the 20s, which was normal, right? I was always told that was normal. With my own research and treatment and trainings, I decided to try testosterone for myself. Once I got my level up over 70 was when I really decided that it was a game changer for me. And so many weird symptoms went away, and I just was feeling really good energy. Of course, all the good libido effects, that's usually the first thing to come along. But I started to notice that I could multitask better, and my mood was better, and I was seeing more payoff at the gym and things like that. So I have found that my optimal range to be more like 90. And I know that that's really far outside of the conventional range, and some other providers may not be comfortable with that, but I am, because I am trial and error with myself here. So I take that into consideration when I have a patient who I'm treating with that. So I did have a little bit of acne while I was transitioning up in my testosterone. So when I was going from 20 to 40 to 50, I did have a little bit of acne. That has since settled down now that my levels are stable and I'm not ratcheting up anymore. But other than that, there really have been no other negative side effects. When you read online about testosterone treatment, or you talk to some other providers who maybe don't use it very often, they get very worried about certain things like clitoromegaly, which is enlargement of the clitoris, changes of your voice, deepening of your voice, growing a mustache. I'm here to tell you right now that is not happening. And I'm at doses that are very normal, and my levels are a little bit higher than average, and none of that is happening. So please let me just reassure you from a personal note that I don't really think that those fears should stop you from trying it. And guess what? If you did have something bad happen, you would just go off of it, okay? And for the most part, anything is reversible. But this is where an approach, a cautious approach of kind of a stepwise increase in your level is really smart also, just to make sure you don't get any, really unwanted side effects. I have seen this over and over for my female patients as well. Once we've gotten them from their quote unquote normal but suboptimal range up to higher, the changes are tremendous and really kind of immeasurable. So, bottom line there is don't take your quote unquote normal result as the end all be all interpretation, and consider seeing a provider who prescribes testosterone regularly if you want to dig a little bit deeper into that. Okay, so next, let's talk about results, right? So, what are the results that I see with someone on testosterone? Some of them are very obvious, and they're the ones you hear about the most often. Like I mentioned, libido, ability to climax, right? Like those are the number one reasons that someone maybe would try testosterone because they were having problems with that. And that's probably the number one thing that people see once they start testosterone therapy. And that's for both women and for men. But I see a lot of other effects that I don't think are talked about enough that I want to share with you here today. So energy, obviously, that one seems a little bit more mainstream, but I don't think just the effect of having more energy is important. It's the ability to have somebody be able to get up in the morning, do their workout, and not bonk in the afternoon. It's the ability to get up and do their mindfulness routine and have that extra 10 minutes to themselves and feel that they're motivated and that they have the energy to do that. It's being able to get it together and do your batch cooking for the week so you can eat healthy meals every day without having to do takeout or convenience foods and things like that. So I just feel like that is a huge bonus for people on testosterone, that they feel like they can do these other things that maybe they weren't able to do. And that ends up bringing a lot more healthy habits into their life that have tremendous amounts of snowball effects. So, next point of improvement, I would say for results, is mental clarity. This is huge. So many women, first of all, they come to me in menopause and perimenopause and they tell me that they have brain fog. They are not able to get things done. They can't multitask. That is a very common symptom. And that could be associated with many different things. But I find when someone gets on testosterone and we get their levels up, all of a sudden that fog is gone. They can multitask, they can function with 25 different tabs open in their brain. They're able to juggle different roles and they're able to do all the things that they feel like they should be able to do in their life. And so that is a huge win. And once again, I feel like just that mental clarity, that ability to get a lot done, surviving in this modern day world, that is a huge quality of life bringer. So I have a lot of people really just grateful for that. The other thing is that mental clarity. I feel like I've had a lot of women come in and they've been diagnosed with adult onset ADHD. That may be true for some of these people, but I actually think for a lot of them, it's undiagnosed suboptimal testosterone, because once we get them on testosterone and we get their labs to optimal levels, they start to feel better. They don't need their ADHD medications. They can get all of their things done without taking stimulants. I would argue that optimizing testosterone has way more added benefits than taking stimulant medications, right? So I know that we're talking about a medication or a medication. I realize that. But I think if we can check a lot of boxes with one of the medications and get someone off of stimulants, that's ideal, right? And a lot of people feel that way. So I've had some very happy patients come back to me and say, I haven't had to take this anymore, and I'm so grateful. Okay, so the next one, this seems a little random, but bravery. And maybe from a very primal ancestral viewpoint, this seems obvious, right? If you think back to our hunter-gatherer era, bravery and high testosterone probably really went together. We needed somebody to step up and be brave and do the things that were competitive or whatever, like hunting, for example. Now, in our modern world, we don't need to go out and hunt like that anymore for the most part. So the bravery comes through in different ways. I see it, people finally standing up for themselves at home and at work. They're finally really advocating for themselves and they're stepping into who they truly are. So is this a chemical reason that a lot of people stay meek? They stay in jobs that aren't fulfilling for them. They stay in relationships that aren't fulfilling for them. I find that when people get their testosterone up to optimal levels, they say, I reclaimed my life. I finally left that job. I finally left this marriage that was really rocky for 25 years. And I'm not saying that that's the best solution for everyone, but that bravery, that being able to really see yourself for who you are, step into who you are, and embrace change, like that's pretty huge. And that may come through in your life in so many amazing and different ways. For men specifically, I will say once they get on testosterone, this has been a really interesting thing because these are just normal men. They're not like trying to run super marathons and they're not trying to defy the aging process or find the fountain of youth. But for a lot of them, they come to me and they say, now that my testosterone is up to optimal levels, I finally feel like myself again. And I feel like I'm ready to take these next steps in my career or with my family or whatever. And that's been really, really interesting to see. So I think if we specifically bring people from the middle or the bottom of the normal range to the top or above the normal range within reason, these are the effects that I see. And it's pretty spectacular. Okay, so next up, I want to just demystify hormone pellets for a minute here. So hormone pellets are just one tool. I use them. I'm not trying to sell them right now. I just want to demystify them because I think there's a lot of blanket statements and misinformation out there. They're just one tool, right? So I use pellets, I use injections, I use topical creams and gels for testosterone. All of them are part of my wheelhouse. And I think that there's a right fit for everybody. So they're not right. Pellets are not right for everybody, but they are right for some people. And so let's define what they are if you're not familiar with them. So basically, they're a compounded medication pellet that is a slow time release filled with medication. And they get inserted through a tiny incision, either in your buttocks or in your love handles, and they get put underneath the skin and they slow release the testosterone or estrogen. There's testosterone and estrogen pellets. It slow releases them for women for 3 to 4 months and for men 5 to 6 months. So for people who maybe have ADHD and really have a hard time sticking with a plan or a routine, or for people who travel a lot and they don't want to be bringing injectables or topicals with them that could squeeze out of the tube or whatever, I find this to be a really great, more like set it and forget it type approach. And so some people love it. It's absolutely a great choice for certain people. It's also absolutely not an option for certain people. I have some people with mental health concerns and OCD or things like that. And I would never use this on someone who really would fear this element of, hey, I have something in me that I can't take out and I just have to wait for it to dissolve. I also never start with a pellet. So I would have someone on some sort of other form of testosterone replacement for 3 to 6 months before we would even talk about doing a pellet. And this is just so I know, hey, how are you responding to it as we're ratcheting up your levels? Are you feeling good? Are you feeling bad? I don't want to go from 0 to 100, right? I want to take it slow. I want to make sure that they're tolerating it well. I want to be able to stop and switch methods or just completely stop it if it's not going well. So that is just one of my rules in my practice is I never really start with pellets. So I do think some providers, maybe if they're only offering pellets, that's a bit of a red flag. So if you go to see somebody, they're like, oh, your testosterone is low, we're going to do pellets. I would say, well, I've never taken testosterone before, so maybe we could slow it down and try something else first to make sure that I like it and that I'm doing well on it before I spend that money and before I have something in me that I can't take out. So I think it's a little bit of a red flag if someone's only offering pellets. The other thing, so this comes up a lot in kind of the mainstream world. They talk about the dosing. Oh, people who are on pellets are supra-physiologic or super, super high doses. And yes, that can be the case. I have seen people who go way too high on their pellet dosage, but guess what? I've also seen people who go way too high on their cream dosage. I recently had someone who was accidentally taking a double dose every day and didn't know it. And we finally figured out what was going on. But it can happen with any medication. So I don't think we should exclude a medication that may be a really great and appropriate choice for somebody just because the provider may accidentally overdose it, or the patient may accidentally overdose it, or maybe they're just really sensitive and they need half the dose that someone else might need. right? This is where that nuance and that individualization of hormone therapy comes in, which is 100% appropriate for hormone therapy. I think it is an extremely customized tool. It is not the same for everybody. And this is true with basically all medicine, right? If someone has high blood pressure, they don't just get put on the same medication as everybody else all the time, right? There's going to be reasons why you would choose one medication versus another, one dosage versus another. Oh, hey, how much is this affecting our desired result? Are you having any side effects? Okay, let's shift to this other one, right? This is the same as we do in hormone therapy. I have kind of my safe, happy starting places for people. And I do tend to start for most people with around the same dose. But then I'll have people who know, hey, I'm really sensitive. I always am the one who's really sensitive. I have the opposite reaction to the medication than they think I will, and all that stuff. Those people, I would take it much, much slower, right? And do a much more detailed and nuanced approach with them and track them a lot more closely. So I just want to point out that I think the blanket statement of pellets overdose people with testosterone is not true. Okay. That may be true for any medication. So it really depends on the patient response, the provider's technique, the provider's experience. So see somebody who knows what they're doing, that uses testosterone regularly in their practice, and they're comfortable with managing that. And that's tracking labs and tracking symptoms and is able to really give you good, solid recommendations on how to modify if needed, right? Okay. So I really wanted to discuss that today because I'm kind of tired of seeing that in the media of people, some very conventional doctors saying, oh, don't ever do pellets. It's not a good choice. And I just really think that's unfair as a provider who uses them really diligently and responsibly. And I have seen many, many patients feel great on them. So kind of summary for that is see somebody who knows what they're doing, consider all of the options, check your labs, right? Check your progress. How are you doing? Shift gears if needed, right? So I hope that this has been helpful information. And I really want to repeat that I have seen testosterone be such an absolute game changer for myself in my own health and in my own personal life, and as well for dozens and dozens of my patients. And I think it's only a matter of time before this becomes more common practice in primary care and in menopause care. But as of now, you do kind of have to seek out somebody who feels really comfortable with testosterone management. And that's not like the easiest thing to find. So if you're in Oregon, I can see you and I can prescribe testosterone. If you are outside of Oregon, I would recommend that you go to the Menopause Society website and do the Find a Provider tool and see if you can find someone in your area. And yeah, so I'll be here again soon with more practical and balanced and nuanced advice for navigating perimenopause, menopause, and also andropause. So this is for men too. So thank you so much, and I'll see you next time.